Hi, good evening, everybody. My name is Ashley Johnson, and I am the Business and Outreach Librarian at the Vernon Area Library. And tonight I'm welcoming our speaker, Michelle Saunders. She is going to be talking about, um, oh, I'm missing your bio here, Michelle,
Oh,
but maybe you can just introduce yourself and we'll get started from there.
okay. Um, my name is Michelle Sanders. So thank you for having me, Ashley. I appreciate it. I work for Illinois Primary Healthcare Association, which is known as a PCA. Primary Care Associations work to educate, fund, and develop programs for local federally qualified health center, community health centers, and work with community-based organizations as well as local health departments. I have a background working as a navigator, so I do have my navigator license to
Amazing.
do insurance for Marketplace. And I also come from a background of having a team from that I used to manage back prior to my job here that also did Medicaid, Marketplace, and we were all SHIP counselors, which that handles the Medicare side of it. So anything with probably an acronym, I have worked. So that for
Very
the sake of
good.
time, I will not give you the full details, but I am a community health worker as well. And I teach and design program development for community health workers on the side. So,
Excellent. Well, as I mentioned prior to hitting record, we would love it if the participants had questions, if they could use the Q&A feature to ask those questions. And at the end, we'll save time to bring those questions to Michelle and see what she thinks or has to say about them. Otherwise, I'm going to hand it over to you. I'm going to be right behind my stop video button. So if you have
okay.
any questions, just call my name and I will appear. So I'll hand it over to you, Michelle. Thank you so much.
Thank you. Okay, can everyone see my screen? Are
I
we
can
all
see it.
good?
It looks good.
Awesome. Okay, well, I will advance. We are tonight talking about unlocking affordable health coverage, your guide to get covered Illinois and marketplace insurance. And you already heard about me, so that's some additional information just to give you a little background about me for your reading pleasure. So we'll keep on going here. So first of all, we want to talk about what is Medicaid. And the definition of Medicaid that is that it's a joint federal and state program that provides health coverage to millions of Americans, including low-income adults, children, pregnant women, elderly adults, and then people with disabilities. Each state has its own Medicaid program within the federal guidelines. This year, the state of Illinois has its own state-based navigating system. So you're going to see some changes in the marketplace sector, but you won't see any changes in Medicaid. So the meaning of Medicaid will give you a little bit background as we go through our slides, but Medicaid will cover a range of services such as your hospital visit, your doctor visits, long-term care, home health services, and just about a couple of screenings that are included in there too, based on the state of Illinois' guidelines. So most of your coverages should be, if not free services, they might have a small copay addressed with them, attached to them, excuse me. So Medicaid expansion in Illinois. Illinois adopted the Medicaid expansion under the Affordable Care Act in 2013. The expansion significantly broadened the eligibility to include all adults with incomes up to 138% of the federal poverty level, and we also call that the FPL. The key impacts of the Medicaid expansion in Illinois included increased coverage for over 650,000 additional Illinois residents, because they gain additional health coverage, improve financial stability. Many previously underinsured or uninsured individuals now have access to affordable health care and reducing their risk for high medical bills. Greater access to preventive care, which is very important. The expanded coverage now allows for more regular checkups and screenings, leading to early detection and treatment of health issues. And then the last part, which is so important right now, is the mental health services are covered for all eligible adults under the expanded Medicaid program. So, Medicaid coverage groups. We have the all kids, which most of the kids in the state of Illinois who apply for and under the age of 18 have all kids if they are eligible in their family. So the mom could have regular insurance, but the kids could be in all kids because the mom does not make or the parents do not make enough for that household. So that could be another form of coverage. Family care is another one where we cover everyone within the family. ACA adult, that's part of the expansion program that we have here in Illinois. Moms and babies. Moms and babies is the coverage that pregnant women who are expecting, but they don't have enough income to get regular insurance or what we call private insurance, then they would fall under the moms and babies as a temporary coverage, or maybe they're underinsured and need additional coverage. So the moms and babies is one of the groups that a lot of, especially single moms, fall under. Former foster care, if someone has children that they are fostering and they need coverage for the children so that they can go get their physicals and immunizations and just regular doctor checkups and go to the dentist, then they can receive foster care Medicaid, which is a different type of Medicaid coverage, but still under the Medicaid umbrella. And then we have aid to the age blind and disabled, known as AABD. And then these health benefits insurance for adults and health benefits insurance for seniors. This program is ending June 30th, effective July 1st. Everyone who fell under this benefit program will no longer have insurance. Some of them, depending on their immigration status, might fall in the guidelines. They've been here as citizens for more than 5 years, then they can continue and receive marketplace insurance. So right now, this benefit is getting ready to sundown out and no longer be available. So there's many people that fall under this program that will be needing marketplace insurance. Medicaid provides health coverage for Illinois residents who meet certain eligibility criteria, including income limits and your immigration status. It can be hard to tell whether or not you are eligible for Medicaid. So if you need Medicaid, the best thing to do is apply. So as a navigator, we tell everyone, and when I had my team, I told them, run them through Medicaid, just run them through. If they do not qualify, Medicaid would automatically kick them over to Marketplace because either they are $1 or more to with not eligible within the income guidelines, or they don't have enough people in their family. So it's based on income and family size to determine where you fall within the guidelines, and that will tell you if you're eligible or not. So when you visit Illinois.gov, you will go on there and you can see the applications for benefits eligibility. So the income requirements to qualify for Medicaid, your income must be below the Medicaid income limit for your household size. Your household size is considered by you or you and your spouse if you live together. even if you do not file taxes together, they still count you as part of the household. It could be your children and stepchildren under the age of 19 and they live with you, your child's mother or father, if they live with you, and if the child is under 19 and also lives with you, or any dependents that you plan to claim on your taxes, and even if they don't live with you, would fall under income guidelines, you have to include them as well. Now, this is the old snapshot. I do not have the 2025 income limits up here, but they didn't change that much. So hopefully this will kind of give you an idea of what the income guidelines are. So let's take a family of 4 and we're going to look and see, and based on their modified adjusted income, based on that, we're going to see what the income limit. So for all kids, and that's the program that covers your children in the family, your income limit for this to apply is $8,268. For moms and babies, your income has to be $5,538. So with this one, unfortunately you have a spin down, and spin downs is a whole different for family health is a whole different situation. They take the difference of what you make and what you qualify for, then that's how much your spin down is. So for this one, they're saying the spin down would be $558. So this is the way that you figure out where you fall on the list and how far you can go up to in order to receive what is called premium tax credits. And I know this is a lot of extra information here, but this just shows you there is a chart that everyone follows. And in this, they can tell whether or not where they fall in order to get the services, or get whether they fall to get Medicaid, SNAP, or one or the other, or maybe both. It gets kind of messy trying to explain this, but this is what they look for. So SNAP resources, basically we look at for eligible SNAP households, the access limit for non-category eligible SNAP households is 4,250 if at least one member in the household qualifies. Then 2,750 for all other SNAP household without a qualifying member. So if you have a person in your home that qualifies, that's the amount that you could have as far as income goes. And then the reference, then we have references here. So I would advise you, when you get this PowerPoint, is to take and visit these sites. And I can download and send this to Ashley. Visit the site so that you can see what the allotment standards are, and they will show you most likely the updated version, because these are not updated on some of these, but it will give you an idea of how it works. So income includes, and this used to be so funny when we were telling people, bring in everything in your household, whatever income you have, bring it in. And then most people would not bring in, if they receive money from self-employment, they didn't do their stated income. So we asked them, well, how much do you normally spend? Well, I don't know, but it's stated income. How much do you get paid? If you are a barber or a beautician, how much money do you bring in? And a lot of them didn't want to share that information. So we always told them, well, bring in your taxes. If you're filing your taxes, bring it in. But you would need wages from your jobs, self-employment backup, which would be, if you have it stated and written down, we sometimes would take that, but if not, your tax return. Social Security benefits, retirement payments, any rental income if you own property, And if you make money from daycare and babysitting, and yes, this is based on the honor system, so you want them to be honest and tell you all the income that they are stating, their stated income that they are witnessing. This is the amount that they have, and then other income or support that you're receiving also. So maintaining Medicaid, there's three steps to maintaining your Medicaid, because most people who don't do this end up losing coverage. Then they come back and ask you, I don't know what happened. Can you help me? Can you find out why I don't have my SNAP, or why I no longer have health insurance or coverage from Medicaid? Well, it's probably because, one, you didn't update your address to let them know when they mailed out your redetermination letter, for us to go back through and go through the steps to see if there's any changes, so that we can report back to HFS so that you can get your benefits continued, or your email information wasn't updated. You also can use ABE, or Manage My Case, which is a portal that you can use on your own, or working with a navigator to help you navigate through the Manage My Case system. It's there to help you in case you need to look at documents, see if they have cut you off or terminated your services for any reason. They will let you know. Know your renewal date. So if you start in June of 2025, next year, June of 2025, and say it's today, the 11th, you have to redetermine your benefits to make sure whatever happened, you might have gotten a raise, or you might have hit the lottery, something took place. You need to do the redetermination and see if you still qualify to receive services from Medicaid or HFS. Then watch your mail for the letter to renew. It comes out 30 days in advance. 30 days in advance, and they mean do it as soon as you get it, mark off and send it back to them so that they can contact you. Or if you're like my parents, they were dual, so they had Medicaid, Medicare, and they needed to submit their information back to their caseworker. But the thing was, because they couldn't come down to the office, they did theirs by the phone, by phone. So if that's the case, you need to let them know you have to, because of a disability, or you might have just had a baby, or whatever the case may be, you can't come down to meet your caseworker. Then you can do it, mail it back to them, and then it can call you and do it over the phone to redetermine whether or not you are still eligible for your services that you receive. And then here is a video that gives step-by-step instructions on how to maintain your Medicaid. Marketplace. So most of you remember back in 2013, they came out with the marketplace for everyone to receive. And in 2014, it actually took off. The Affordable Care Act, also called ACA or Obamacare, a lot of people call it so many different names. They had it floating around, different acronyms, but this health insurance is the exchange to be established in every state, through which consumers can purchase health insurance coverage and receive financial assistance. That's that premium tax credit that I was talking about in the slides previously. And if you qualify for that premium tax credit, you might have a tax credit of $500 that would be applied to your monthly premium, and bring your premium down to whatever that amount is. So sometimes there's some financial assistance that comes along with the marketplace for health insurance. But the Centers for Medicare and Medicaid Services, CMS, uses this term marketplace to better explain what these exchanges do for consumers. The term marketplace and exchange are synonymous. So Illinois effective January, just became a state-based exchange. So we're no longer on the federal side. Now, remember when I was giving you the definition of Medicaid, I said it was funds that come from federal and state in order to make up your Medicaid. Well, for Marketplace, we state of Illinois used to be on the federal exchange where we would go to healthcare.gov. I don't know if some of you are familiar with that term. During open enrollment, it's all over the news and on commercials and everything. But we were getting funding for navigators for the federal side, and also you could go and get your insurance, marketplace insurance, off of the exchange that the federal side or federal government had set up. Now, Illinois has a state-based exchange. I'm not sure who our new providers or vendors will be for insurance for 2026, but for 2025, we were able to keep those that were on the exchange from the federal side. So in saying this, we had, for example, Blue Cross Blue Shield, and they had the silver, the gold, and the platinum types of insurance. Depending on whether or not you wanted a higher premium and lower copay, or whatever the case may be with those types of plans, we could go on that exchange and pick out your insurance. Now we're going to have new healthcare.gov, and I don't know what the name of the platform is going to be and who is going to be part of the insurance family that for Illinois. I don't know who we're going to have as vendors, but that will come out later. I think in September is when they're going to announce who we're going to have to be the vendors for the insurance. But the best thing to remember when you have Marketplace, and you see starting January 2026, Illinois became a state facilitated marketplace. Whatever you do, or if you pass this information along, always tell everybody do comparisons, plan comparisons. If anything, remember plan comparisons, because when you compare the plans, depending on what it is you're looking for, whether it's based on if your provider is in the network, your medications can be covered, whether or not you want to pay no copay but a higher premium, whatever your situation is, based on what you can afford, you want to compare the plans that are offered so that you can have make a better decision on the type of plan service you want. So attaining coverage. A person can obtain coverage using healthcare.gov for right now. You have until September when we start the new grant season for Get Covered Illinois. Illinois Primary Healthcare Association, IPHCA, funds sub-grantees to hire navigators to go and help you to navigate through the system. So we help with project management of those organizations, which consist of federally qualified health centers and local health departments. In saying that, we will not be using healthcare.gov. But until that time, if anyone is needing assistance, we can do a warm handoff to a navigator to assist you, and they're going to be using the healthcare.gov platform until September. Another way to find out who is near you that can assist with you getting coverage, you can use the local help tool. You click on that, and it will put it will ask for your zip code and tell you who is the nearest organization that has navigators that can assist you with obtaining your coverage. So those are kind of some tools that you can use for Get Covered Illinois. And again, maintaining coverage through the marketplace. special enrollments. Special enrollments only take place if you miss your sign up for insurance with your organization. You didn't get insurance, but now you need it because you have to go see a doctor. That's a special enrollment period. Um, if you did not, oh, you got married and you weren't on your spouse's insurance. Now you need insurance until they have open enrollment at their with their organization. Then you can use the special enrollment period to get insurance or get marketplace insurance. Health insurance marketplace, they give you, they say 60 days, but a lot of people have been, once you make your first payment, you normally the next month, if you apply today, like today is the 11th, so after the 15th of this month, you would go to August 1st. But if you do it before the 15th of this month, you would go into July. So that's how that works. But if you had a change in your household, maybe you expanded your family, you need more family coverage, you don't have it, you change your residence, you move to a different location, or just had loss of coverage, then with the loss of coverage, you can go through Medicaid and see if you apply because you are not working, um, or whatever the reason why you lost coverage. You can go through Medicaid to see if you qualify. If not, you would use this SEP, which is a special enrollment period, in order to get assistance. Illinois Enrollment Collective. So in-person counselors ended in 2016. The funny part about it was they started in 2014 because I remember when the program came out for in-person counselors. So now we have navigators and certified application counselors, better known as CACs. Those were the individuals that I had working for me when I worked for the community health center. And they had the background navigators. You have to be, well, both of them, you have to be licensed and go through the training in order to be able to do marketplace. No one can do marketplace by you can do marketplace. Let me go back. You can do marketplace by yourself without any assistance. But if you are needing a navigator or a certified application counselor, they have to go through the actual training to understand marketplace and the ins and outs of doing the plan comparisons. This is coordinated statewide with meetings with Illinois Healthcare and Family Services, also known as HFS. We partner with Get Covered Illinois, Enroll America, Young Invincibles, and the Shriver Center. These are our 4 partners that help us stay on top of advocacy, help us to get the proper training for navigators, to stay on top of different trends, what's happening around Medicaid, which is a lot right now, and then what's going on with our marketplace. Same thing, lots going on with the healthcare and access to care. We also use Poverty Law, Shriver Center Against Poverty Law, and DuPage Federation. Those are resources to help us. Enrollment tools for navigators, just to help you a little bit further. We have Help Hub, connector tools, screener tools, and with the Help Hub, that we give them questions when we have something that comes up and we're not sure how to answer the question correctly. So we will go to Help Hub to give us an answer to help you. The connector tool, which we use currently, and I'm not sure if that platform is going to be available, but it lets you see who is available to help you based on that find local help, the zip code. So you can go on there and schedule an appointment, make an appointment with a navigator to help assist you with marketplace, or have them go over your Medicaid with you to kind of walk you through what the problem is, or if you need to do redetermination. FQHC's focus on outreach and enrollment as of 2013. Well, we are still doing the same thing. Outreach and enrollment is so important right now, especially on the Get Covered Illinois and the HFS grant that we have in order to fund the FQs in the local health departments. So outreach and enrollment, and I always call it education and awareness, to get the messaging out there that we're changing to a state-based platform, that we have navigators throughout the state of Illinois that can assist you with your marketplace or Medicaid redeterminations if needed, and to make sure that everyone has access to care. Some of the navigators are community health workers and have that background, so they can connect you to social determinants of health, which are transportation, housing, food, education, financial assistance, whatever it might be. Some of these navigators also have the same background. If they're not a CHW, they still can link you to the proper services or do a warm handoff to you. Illinois Coalition of Health Access was located in 2014. That's how we keep track and keep updated on a lot of services and policy changes, what navigators should know in order to help the consumers. This coalition is statewide, and they meet monthly to discuss information or keep you in the know of what's going on for advocacy and what's happening with healthcare situations. And then development of Illinois Protect Our Care was established in 2017. So, where to find marketplace resources? Now, this is what we have currently, and that's my disclaimer because it is subject to change after September. But currently, right now, if you need to find resources about marketplace and what's going on in your community, you can utilize these resource links and to help kind of give you some guidance on qualified health plans, what it takes to get certified, which would be like what we have to do for marketplace. So that little piece was thrown in there just in case you want to see what oversight takes place when a person needs information about marketplace and how it works and what happens with those who get certified. Medicare. So even though we're talking about marketplace and Medicaid, Medicare is another form for some people who are 62 and over. And I always say, depending on when you're going to retire, and I think they're trying to change the retirement age, but some people fall within 62, some people do 65, and some do 67. And depending on where you fall within the Social Security guidelines for Medicare. But I always say you use the 313, which is what we were taught as ship counselors, is 3 months before your birthday, 1 month, which is your birthday, and you have 3 months after your birthday to apply if you're going to take Medicare. If you're going to get Social Security benefits, you need to do the 313. So that's how you remember 3 months before your birthday, the month of your birthday, and 3 months after, you can apply if you're planning on retiring and coming out. Now, in saying that, you need to make sure that you work with a ship counselor to make sure that you don't have to pay a premium based on your income or what other factors that will determine if you don't have enough hours into your Medicare. And, that is covered once they put all your information in and find out about you coming out and utilizing Medicare. So Medicare defined is a federal health insurance for people 65 and older. Some younger people with disabilities and people with end-stage renal disease can apply for Medicare. I know my mom had applied at age 62 for Medicare because she had end stage renal disease. So that made her eligible to receive Medicare. Otherwise, she would have had to wait till she was 65. So, depending on your disability, if you have one and you can prove it through Social Security, then you can apply for Medicare. Coverage, it covers hospitalization, home and skilled nursing, hospice, medical insurance, and prescription medications. And then they're even changing Medicare. I know a little bit. Right now, everybody's going to Advantage plans, and it's easier because everything your A, B, and Plan D, which is your drug. A is hospital. Those are all covered in one plan. So you just depending on who you're going with, like Humana or WellCare or whoever else is out there. Medicare is divided into 4 parts. Part A is the insurance for hospitalization, home and skilled nursing and hospice, if you have to utilize those services. Part B is your medical insurance. And Part C, which is your Medicare Advantage plan. This is the private insurance option for covering hospital stays in your cost, and for Advantage plans that you have your Part D rolled in that too. So those are the 4 parts that are covered under Medicare. If you begin receiving Social Security retirement benefits between the age of 62 and up, you have 4 months before turning 65. You will be automatically enrolled in Medicare Part A. Now, again, if you're receiving Social Security benefits, that's the only way that you can get your Medicare Part A and Part B. And that's 4 months before you turning 65. If you apply for Social Security benefits 3 months before you turn 65 or later, 313, you can sign up for Medicare when you apply for Social Security. So if you're planning on retiring now at 65, then this is when you can do it. The initial enrollment period to sign up for Medicare begins 3 months before you turn 65, when you turn 65, and then ends 3 months after turning 65. So a total of 7 months, 313, you may have to pay a penalty if you miss the initial enrollment period. And when I say pay a penalty, you have to pay a penalty. So it's going to be a little cost to you if you miss those dates, and you're applying for Social Security. So you have to know, when is it that you want to apply for Social Security? Do you want to take the full benefit at age 65? You want to take the partial benefit at age 62? Or you may have to take it at, partial at 65, or you want to take it at 62 because you can no longer work because of a disability. If you are not ready to receive Social Security benefits at 65 because you are still working, okay, by the time I get there, that's probably going to be me. You can apply online for Medicare only. If you're not going to take Social Security, you can take Medicare. If not, you'll have to, if you don't take Medicare, you can continue paying. If you're working, you can continue paying what you pay for commercial insurance through your employer insurance. Or you may be able to wait until you retire and sign up during the special enrollment period. Those are some options just for those in your 60s. Learning your community. So identify resources for low income and uninsured clients in your community. Which hospitals provide care to the uninsured? Which federally qualified health centers or community health centers are in your communities? Are there free clinics and charitable clinics in the city? Now, I kept saying for the longest time, there are no free clinics. There are no free clinics because you either have a sliding fee scale, you use Medicaid, or whatever the case may be. Trust me, there are free clinics in Illinois. In fact, I have one that's in our program currently. So there are some free clinics. You just have to search and find them. Then find out in your community what resources are available, and to those with limited English proficiency. So if everyone doesn't have English as their first language, then we need to find out what resources and materials are out there available to them in their language. Now, we know normally we have Spanish, English to Spanish um, materials. But now we're finding out there's a lot for French and oh, someone else gave me another language that's popping up in their community. But French and Spanish seem to be on the rise right now. Then, where can clients enroll for Medicaid, Marketplace, or Medicare programs? Most likely, your federally qualified health centers or community health centers, and some health local health departments have navigators on hand. And if you don't know in your community who can assist you, you can always reach out to Illinois Primary Healthcare Association. We will do a warm handoff and get you to the right person. Then, what is being debated in your city? What are they talking about? What type of access to care do you have? What organizations are advocating for clients in your communities? These are all questions you should be asking and learning about your community if you don't know. And most people have navigators and community health workers that work in this realm where they can get or answer those questions for you. And you can even ask them when you're meeting with them to get your insurance marketplace or Medicaid. So a resource page for, now this is for CMS navigators, certified application work counselors, and community health workers. This is what we use currently, subject to change depending on what we're led by government, so it depends on what's going on. But October 15th, open is open enrollment for Medicare. So anyone who's in their 60s, whether 62 for disabilities, 65 for retirement, or working until 67. This is an important date that you need to know for Medicare. Open enrollment for Marketplace starts November 1st. Right now, we're not sure if it's still going to continue through January. They said it might be a short window and they might close it down in December. So whatever the case may be, that information will be out in the communities based on Get Covered Illinois. They will have a marketing campaign to let people know where and when Marketplace will open up. Medicaid is year round. You don't need to be a navigator or a certified application counselor. Anyone can do Medicaid. You can do Medicaid if you want to get on ABE, or if you want to get on Manage My Case and open up the portal and do it yourself. But if you get stuck, you can always reach out to one of the different navigators to help you. And also redeterminations. Those are so important when you're on Medicaid. Make sure if you change addresses, let your caseworker know. If you didn't receive anything and you know it's your anniversary date, June 11th, 2026, then you need to be reaching out to somebody to ask, where's my redetermination? Or go on Manage My Case and see what happened. And then the federal poverty level that comes out every February with the rates of where you fall for income levels, whether or not you qualify or eligible for Medicaid services. Things to remember. For unemployed individuals, options for coverage would be Marketplace, or and two, continue coverage with the option which would be called Cobra, which is very expensive. But Cobra allows you to keep your employer sponsored health plan for a limited time after losing your job. However, you must pay the full premium. So employer was paying total cost $600, but you were only paying two, you would be paying the 600 plus the 2% admin fee to administer you to get the insurance. So it's very expensive. And if you have to do it for a husband and wife, that's $1,200 plus the admin fees. So, kind of figure out where you are on that one. For self-employed individuals, what health insurance options are available if you're self-employed? Well, you can purchase individual health insurance through the marketplace or private insurance, sure. You can go through like Blue Cross Blue Shield or Humana, whoever you want to use after you price shop and get private insurance. Otherwise, you can also get marketplace if you are self-employed. Are there any tax benefits for self-employed health insurance? Yes. Self-employed individuals can deduct up to 100% of their health insurance premiums for themselves, their spouse, and dependents on their from their adjusted gross income, not on the total income, but on the adjusted. So you can deduct up to 100%. And then can you get coverage if you have a pre-existing condition? Yes, marketplace plans cannot deny anyone coverage or charge a higher premium just because you have a pre-existing condition. So those are things to remember and just be mindful of. And again, Get Covered Illinois is the official health insurance marketplace. I'm sorry, I got to throw a little plug in there for Get Covered for the state of Illinois. It helps residents find and enroll in health coverage that fits their needs and budget. Here are some key components and features that you want to remember. Plan comparison. Compare the plans when you look at them. They have normally 3 to 4 different plans under each vendor or provider, whoever is going to be for the state of Illinois. You can compare the plans and which plan best fits your budget, and if it has offers you a premium tax credit. Financial assistance. There are programs available to make the coverage more affordable, and that is the what I just talked about, the PTA, the premium tax credit. That's what lowers your costs. So if you are eligible for premium tax credit, it will lower your costs. Special enrollments, we talked about that. Those are called SEPs, and the different life-changing events that allow you to enroll outside the regular enrollment period of November 1st. So if you need a special enrollment because of a circumstance that happened, then you can get marketplace. If you're not really sure that you qualify, you can always reach out to a navigator. And then support. Local navigators, community health workers are always available to provide guidance and support throughout the enrollment process. But visit Get Cover Illinois website for additional information and resources. They have a resource tab that will help you to understand how to get the information and resources that you need to know about marketplace enrollments. So, again, my name is Michelle Sanders. I'm the Associate Director of Health Access for Illinois Primary Healthcare Association. There's my phone number and my email. If you run across a problem and you need to have a warm handoff, we have 42 at the moment. We have 42 organizations. I'm sure I can find somebody to assist you. And if they can't, I'll try to assist you myself. So thank you. I appreciate the time and having me here to speak about Marketplace and Medicaid.
Very good, Michelle. Gosh, you know a lot of things about a lot of things. Like, there's a lot to know, right?
Yes, it is. Sometimes overwhelming, but it changes daily. That's what I'm saying. Everything changes. So hopefully, we'll see where we're at.
Well, and just for our audience at home, I want to share the I mean, I understand that this is statewide, but our Vernon Township, where we're situated, the library is in the Vernon Township, and where I assume a lot of our patrons reside.
Mhm.
The Vernon Township has SHIP counselors that work with people, and I just recently saw that in their newsletter. So it's not just something that happens during open enrollment. It's not something that it's year round, and people
Mhm.
need people around to help them navigate these changes of life that happen year round. So it's not
Yes.
just in November and October that people are looking to gain access to Medicare or Medicaid. But the Vernon Township is a place that employs or has SHIP counselors that are available to
Mhm.
you. So I do have several questions. If you're ready for me, I can kind of
Yeah.
just start. Okay, good. Um, The first question is, how is this Medicaid income requirement different from the Obamacare requirements?
Okay, so the federally poverty level is the same for both of them. So depends, but it's based on income and household size. With Medicaid, that's state, and that comes from the state. So you're getting actual Medicaid services, SNAP benefits, which is your food. It used to be called food stamps. That's your link card or your SNAP for food. And also the Medicaid services that are covered are limited to certain services that you can get, certain screenings and all that. Now, when you go to Marketplace, which is Obamacare, ACA, you're looking at paying a premium because you're paying for this insurance. Medicaid, you're not paying. You're not paying anything for Medicaid. Marketplace, you're actually paying out of pocket, but to lower the cost, they use the premium tax credit to bring that cost down.
Mhm.
So you're still using income, you're still looking at family size when you're plugging it in and all that kind of good stuff. When you're going on there, they have to know what your family size and who's being covered in your household. So income has more effect on Medicaid than it does on Marketplace.
Okay, that's a good sort of segue into the next question is, do all of your assets such as living properties, savings, etc., are those taken into consideration for Medicaid qualifications?
Yes, it is. So that's why you see some older individuals getting rid of their assets, clearing out their savings accounts, and maybe putting it into, you didn't hear me say this, but putting it into their children's names so that that's not counted as part of their income. A car, that's an asset. They count that, the value of your car. Life insurance policies, they count that. That's an
Oh,
asset also because of the value. If you have a universal life policy and it's worth value, it's worth 2,000, but it's a $25,000 and it's still building and still building. They're going to count that $2,000 because you can take that out as cash. They're going to count that as income. If you have a pension, like a railroad pension or what have you, they're going to count that as income. So
do they
yeah.
count your debt?
Huh?
Do they count your debt?
No, I wish they did. No, that would help a lot of people if they
That would
counted how
help.
much debt
Yeah.
everybody's
Okay.
in. Yeah.
Okay, so someone else is asking, you said Illinois has set up a state marketplace. Is Illinois also setting up state-based plans? If so, how will those plans differ from ACA plans?
Okay, so ACA, those are the plans, the Affordable Care Act. It's all whoever they go with, and I don't know, they have not released the names of who they are. Blue Cross Blue Shield, I know, I was told, will not be in the exchange. They are not going to do it. And they were one of the bigger, heavier hitters for the longest time. Now that might change after negotiations and whatever they do on the state level, but they have not told us who. It could be Aetna, it could be Humana, it could be anybody. We don't know yet who is going to be the providers yet. They haven't told us.
I guess I have a sort of subsequent question. But so ACA might have Blue Cross Blue Shield, but Illinois Get Covered might not have Blue Cross Blue Shield.
They're all one and the same. AC,
So so
ACA
ACA won't have Blue Cross Blue Shield.
right now, no, they're
Right.
not
Okay.
going to
I don't
cover.
wanna stick you to it, but,
Yeah.
I just wanna sort of clarify that, like, ACA, if you live in the state of Illinois, you're going to be using Get Covered Illinois.
Okay, so Get Covered Illinois is just an organization. They are an organization that funnels funding out to organizations like mine, and they do the oversight for HFS, Health and Family Services. So the state money and the state exchange all is up on that level with HFS. They control all of that, and working out the negotiations, because marketplace and the exchange, which is the exchange now, state-based exchange, all filters through them. Then it
Okay, but
filters
so,
to get
again,
covered.
like, you can't in the state of Illinois, you don't have a choice between going to Obamacare and this Illinois state-based marketplace.
No, they're all one and the same. So,
Gotcha.
yeah.
Okay.
And I know it's kind of confusing, but the term ACA is marketplace. That
Gotcha.
is the marketplace.
And I
Now,
sort of was picking up on that when you were talking.
uh-huh.
I just wanted to clarify.
And then Get
Okay,
Covered is our funding organization
gotcha.
oversight for all of us.
Okay. And then what do you need to know if you're on Medicaid and no longer qualify during the transition from Healthcare.gov to the Illinois marketplace? Are there timing transition considerations?
Ooh, okay. So they're working this all out right now as we speak. So I'm not really sure on what's going on. But if you have Medicaid, there will be no changes, because the state of Illinois, well, let me go back up. Um, Medicaid is under fire right now, and from what I understand, um, the current administration is trying to pull back some monies. So I don't know what's happening with right now, but with Medicaid, we don't know. We've been getting notices over, so it's been up in the air. Now the ACA, which is your marketplace, is subject to change now, since we're going through state based, because we don't know who's going to be the providers. So once we find out, they all should offer affordable plans for everyone. Now, affordable means a lot to different people, but it's also based on what services you're asking. If you need, if it offers dental, vision, regular health insurance. I know dental and vision are separate. You have to add those on to your marketplace plan. Marketplace plan currently has the bronze and the silver plans. The silver plans are the cheaper or most more inexpensive, and then it has the gold and gold, bronze, and silver. Silver is the best ones right now because they're affordable.
As another aside, I'm reading this book right now. It's called Disability Visibility, and it's talking about how people that have disabilities and require Medicare no,
Mm-hmm.
Medicaid are just in this very unfortunate situation because, besides the fact that they're dealing with the disabilities that they have to kind of jump through all these crazy hoops, and any sort of change to what is it's just a very complicated process.
System.
So that
Mhm.
are there resources like are SHIP counselors also educated in Medicaid?
Okay, I'm gonna say yes. One, because you had some people who had Medicare and Medicaid together, and they're stopping the MMAI program and going to a new program called DSNP for the state of Illinois, which is coming out, rolling out. I missed the last meeting, so I don't have a lot of information about it. But a SHIP counselor has to know a little bit about Medicaid, because most of your um, elderly or older individuals need to have, because they don't make enough on Social
Yeah.
Security, they have to have the Medicaid to support their Medicare to cover,
Yes. Oh, it's
for
a
regular doctor visits.
hmm. Wow. So any changes are it really kind of creates a ripple effect in
Yeah, it does. It really
processes.
does. And it's hard because the people who really need it, now, granted, there have been people that have abused the system. We all know that, but there's more that outweigh that need the
Oh,
services and to cut Medicaid from older individuals or to for people who really need it and have disabilities and they don't have enough income to go and go to the doctor. That's limiting access to care and also provide creating a bigger health issue in the communities that they live in. So you'll see more people being sick or not going to the doctors because they can't afford it. And that, I mean, it is a ripple effect. It is.
Well, in this, I don't wanna go on a tirade, but this person is the person in the book that I'm reading, she is a, adult who is living with, like, she's a quadriplegic, and she has
Mhm.
extreme, physical needs, and they bill in a monthly manner, and
Mhm.
so those hours that she gets based on her need are all measured and defined by Medicaid, and
Yes.
if there's a pause or a blip in Medicaid, it can stop her from having life-saving services, or even just, like, living, somebody to help her use the bathroom that comes to
Yes.
her house. Anyways, but, okay,
So
so
those kind
the
of services, though, I can tell you, they're billable services in order, especially if you have a spin down. And we talked a little bit about spin down. So, for example, now my dad has a spin down because his income and his social security are way too high, but I know he needed services. And in order to meet the spin down, we utilize the services from his homemaker because he has mobility issues where he doesn't get around so well. So those extra dollars go towards his Medicaid to help make sure he can make doctor appointments and so forth. But
Mhm,
let the agency that submits that information to the Department of Health and Family Services, if they miss, they cut him off automatically. They
right,
cut him off. And then you have to go back in and reapply to
yep.
put it back into the system, which causes a lot of,
And
um,
add that to the already,
yes,
the issues that they're already dealing with, it's like, I.
yeah,
Anyways, I wanna get back to the Q&A because somebody just asked, "I'm more confused after the Q&A about the change for Illinoisan ACA plans.
okay.
Payers enter and leave the marketplace every year. What are the major elements and purpose behind why Illinoisans can't use Healthcare.gov after September of this year?"
Oh, because well, okay, healthcare.gov was, remember I talked about CMS. Um, they are a federal organization. Healthcare.gov is a federal organization that has that platform to go out and purchase the insurance.
Mhm,
Since we are now state based, and Get Covered Illinois is the new CMS. They have their own, which they're being trained on right now. They have their own platform that we have to use for the state of Illinois. We can
mhm.
no longer, after September, use healthcare.gov.
Are there
Only,
there are benefits to that though, right?
well, we get to run our own platform basically, and we don't have federal oversight like we did before. We just have state oversight, which
Mm,
that's what health and family services does. They are the oversight people that pass this on to GCI, which is Get Covered Illinois. So they are the main ones that now whoever they fund, that's who they have to oversee to make sure they are within compliance and the guidelines of utilizing the platform, getting people insured, all of that. It's a lot behind the scenes that people don't see. So
but
on the
they negotiate the same as they would for ACA for the plans that are provided.
yes, it's the
Okay.
same thing. It's just that we may not have the Blue Cross Blue Shields, we might have Aetna, or we
Well,
might
they
have,
might not either.
yeah, we might, I mean, and we don't know yet because we don't know who HFS has negotiated with to
Gotcha.
be on the state platform.
But there are other examples of this, like, I think is it the state of Minnesota has their own state
Yeah,
platform? Yeah, there's other examples
There's
across the
others.
country of other state-based marketplaces.
Oh, yeah. I mean, I think I want to, I hope I'm correct on this. I think we were the 13th state to
Yeah,
go yeah, to go state based. And
and it's a
I'm
nice list, it's like Massachusetts.
yeah. But I'm glad that we did because of what's going on right
Yeah,
now. You're not sure you're going to, I mean, those that are on the federal exchange, they don't know what's going to happen, not with the changes in administration that that could get held up or anything. I mean, we don't know. So
yeah.
I'm glad we got out when we did. And I had the date when we did it. It was January of this year. We turned into state base. We went state base. So I think we got out in just the right time.
I remember when that happened, and that's when I set up this program because I was like, "Wait," I kind of felt like the state of Illinois kind of didn't really talk about it as maybe as much as they should have or could have, or I guess they felt like it wasn't necessarily, I don't know,
Well, they were
relevant.
trying to do the smooth transition where nothing goes seamlessly, but they wanted it to be seamlessly where no one noticed that something was taking place. And then they're
Yeah,
coming out with this big campaign in September. They're
okay.
doing a large marketing campaign to let people know the one thing I said we project manage 42 organizations. They were supposed to be out letting people know we're no longer going to be using healthcare.gov in September. We're moving to a state-based exchange and explain that to people. So when we do go and you can no longer get Blue Cross Blue Shield, but now we have these other plans, you know why. And
You know,
so education and awareness was supposed to be taking place now. And we yeah, you're on it. But our navigators, I don't know if they were really telling everybody that because, people go into shock when they have something new. It's like, oh, so what's going on with my insurance? What's going to happen with the marketplace?
serious
What we
business. Yeah.
Yeah, they get paranoid because they don't know. Well, if you tell people ahead of time and start educating them and let them know in September, this is the direction we're going. And I believe, I hope I'm correct, that something's going to come out from the governor office anyway, because it all has to go through him to be approved anyway. So,
So then just kinda to put a cap on it, the difference between the state-based program versus the ACA program is that the state of Illinois is managing, well, maybe you answer that. What is the essential difference between the state based program versus the federal program?
okay, state based Illinois has control over their marketplace, over who is on their marketplace
Mm,
and how it functions in the oversight. Whereas before, the federal side, CMS, they had oversight over what we did and how to stay in compliance and how much money we received to pay out organizations to be doing the work. Someone has to do the work. You need the foot soldiers out there to do the work. Well, we have over 102 navigators out of 42 organizations. We have over, well, maybe more than that because they added on a couple more people, but we have over 100 navigators throughout the state of Illinois that can go and enroll you and assist you with marketplace, assist you with Medicaid. The only thing they can't assist with would be SHIP because this is um, marketplace focused only
mhm,
from the funding that we have that we give to the subgrantees. So when GCI gives us dollars to fund these organizations, they can only do marketplace or hire a person to do only marketplace and Medicaid applications. No
mhm.
other duties, no SHIP, no anything. Just strictly outreach and enrollment, outreach and enrollment, education, and bringing that awareness of what services we have to offer.
Hmm. So it sounds like a little bit more bang for your buck for
Yeah,
the services that
basically.
you're provided by those the counselors.
Mhm. Mhm.
Okay, so hold on, there's one more question and then we'll let you go. We're going over
Yeah,
time
you're
here.
fine.
I used to work in health insurance. Please give the feedback that it would be more useful to have clear talking points about these changes. Earlier, you're saying there's not going to be a state-based plan, but the plans are the same as ACA. I'm unclear.
Okay, so ACA, the Affordable Care Act, is actually marketplace.
Mm,
So that is marketplace.
okay, for
And
us.
for us, that's for everyone across the United States.
Oh,
ACA and marketplace, that's the same thing. The only thing different is the platform that we're using. If you think about Facebook and Instagram, those are two different platforms, and they function almost similar, but they have different features on it that you can do. One can do reels, and the other one can just do, you scroll through. Well, with the state based exchange, everything is controlled by the state of Illinois. Illinois controls their own exchange and how the platform is set up, designed, how it functions, all that good stuff is done through the state of Illinois and for the state based exchange. Healthcare.gov on the flip side was a federal platform, and that federal platform, they would fund Illinois, give them so much money. You have to write a grant for, because I wrote for the CMS grant when I worked for the health center that I came from. And I wrote for $500,000 of all the money that they had to offer for the United States. And they
wow.
didn't fund everybody. So that money that they gave me, I could um, pay for the navigators to do the work out of that money. Now, on that platform, they would have four different insurance companies. It could be Blue Cross, Aetna, Humana, and WellCare. All of them offer different plans. That's why you have to do comparisons. You have to shop all the plans to make sure you're getting the most affordable one for you. It may not be a Blue Cross Blue Shield plan. It might be an Aetna plan that is a silver plan. So the federal is totally different, and we don't have it anymore after well, we're not using it right now. We're just using their platform until ours takes place in September. And I
Okay.
don't know the name of our new platform. They have not released that information, but um, the federal platform is going away, and then you're going to have just a state platform for Illinois. We'll have our own platform, and it might be called stateofillinois.gov. I mean, I don't know what they're going to call it, but that would be our new platform.
But we're not negotiating for our own, um, plans. Like, the state of Illinois is not negotiating with Aetna.
Yeah, they are. They're negotiating with whoever they're going to have on that platform. State of
Wow.
Illinois does.
Okay, so I guess
So
it's just one of those things. We gotta kinda stay tuned in and find out.
yeah, because we don't know either. It could be, I do know what someone had said, Blue Cross Blue Shield wasn't going to come on the platform. I don't know if they are or not, but it could be the same people that they currently have right now on healthcare.gov, but they have to negotiate with them to get them on the state platform. And maybe they
Got
don't want to do it. I mean, we don't
it.
know until they release those names of who is going to be on there. And it's funny you say that, because someone asked that in one of our meetings. Do you know who is going to be on the platform? They don't know yet, because HFS is the one who is over all that, and the governor, who is going to negotiate who is on that platform. So we'll find out closer when it gets to September. They'll release who's going to be on there, because we don't know ourselves.
But the state of Illinois gets to decide how they wanna allocate the funds that go into these programs as well. So that's
Yeah,
another big added value.
that's
Like,
another,
they
yes.
might be able to take the money from, I don't know, iPass or
Right.
other
You never
gambling.
know. We don't know and it's weird because we still get federal funds sent over to us for our state for Medicaid, but
Portion,
I don't
yeah.
know where the funding is coming from for the state for Illinois, where they're getting the money from. I don't know how they're doing that. So that, they could be pulling it from, yeah, all those tollways that I keep going through and paying. They could.
Right, like, eventually that's gotta come back. But Michelle, you're very informative. Thank you so much for your time tonight, and thank you to everybody that tuned in for your questions. And like I said, we were recording tonight, so I'll be able to share this out, and you can go over, or you can, watch it and grab Michelle's contact information if you need it. Um, but yeah, I wanted to just thank you all for attending, and thank you to Michelle for your time tonight.
Oh, you are welcome. Hopefully it was helpful and not too confusing, but insurance overall is confusing. So
Confusing. Yep. This is why we pay the people to do the things. But also, like I mentioned, I know that the Vernon Township does have ship counselors. They are a resource to us in our community. And like Michelle mentioned, be aware of who the resources are and where the places are in our community. And if you have any questions, if you don't ask Michelle, you can always reach out to me, and I can try and be your personal librarian and find you the people that you need to talk to about the things that are important to you. So, thank you to everybody, and have a great night.
thank you.
Bye,
Take
Michelle.
care.
Nice to meet you.
You
Bye bye.
too. Thank you.